Good afternoon, everyone. I'm Dr. Miguel-Decena. Today, I am excited to share how I've integrated lifestyle and rehabilitation medicine, specifically in managing knee osteoarthritis. As a relatively new practitioner of lifestyle medicine, I'm eager to learn from all of you and share my experience. Let's dive into the case and explore how lifestyle medicine can enhance patient outcomes. I'd like to introduce my patient. Let's just call her Feli, a 60-year-old widow who stands at 5'2" and weighs 154 pounds, giving her a body mass index of 28, classifying her as overweight. Her waist circumference is 37 centimeters and her hip circumference is 40 centimeters. The calculated waist to hip ratio is 0.93. Feli works as a dry goods and sari-sari store owner at a local market, which means her daily life involves a lot of standing and lifting. She lives in a bungalow home with her mother, sister, and niece. She used to love dancing to TikTok videos, but now her knee pain has made that cherished activity significantly limited. Given her situation, she's an ideal fit for our integrated lifestyle and rehabilitation medicine program. Let's fill in Feli's medical history. Her chief complaint is left knee pain that's been gradually worsening over the past 3 years. She describes it as a dull ache, but gets sharp when she tries to go up or down stairs or squat. It's typically worse at the end of the day, and she experiences that classic morning stiffness for about 15 to 20 minutes, fitting our osteoarthritis profile. Her functional limitations are significant. She struggles with stairs, often having to hold the railing and take one step at a time. Getting in and out of a vehicle is a struggle, and prolonged standing or walking causes significant discomfort. So this directly impacts her ability to manage her dry goods stall. Regarding her past medical history, she has hypertension and hypercholesterolemia, all managed with medications. Importantly, she has no prior knee injuries or surgeries. The patient's maternal family history indicates a presence of hypertension. She has a history of smoking. Commendably, she quit 5 years ago. So this is a good sign of her ability to make positive changes. She is a non-alcoholic beverage drinker, and her current medications are for her chronic conditions, and sometimes she takes over-the-counter ibuprofen for her knee, which affords only limited relief. When we conducted her lifestyle assessment, we uncovered several key areas for intervention. Feli's 3-day dietary recall reflects common Filipino dietary patterns. Breakfast often consisted of pandesal with margarine and 3-in-1 coffee, or sometimes tapsilog or instant noodles. Lunch usually is a local eatery bought meal, typically fried chicken, menudo, or pork adobo with white rice. Common choices for merienda are banana Q or turon. Dinner is usually similar to lunch, another meat-based dish with white rice. She also admitted to preferring sugary juices and soft drinks over plain water. Her demanding work as a vendor often makes local eateries a convenient choice for meals. While she does incorporate some fruits and vegetables, she tends to favor meat dishes. So this highlight a significant opportunity for dietary modification given its link to inflammation and weight. Despite facing the challenges of knee osteoarthritis, the patient consistently demonstrates a remarkably cheerful and positive outlook on life. This is evident in her reports that even with knee discomfort, her sleep quality remains good. She has a positive outlook. She feels confident, and her mood is not negatively impacted by the pain. Furthermore, she continues to maintain strong social connections, actively engaging with her family and friends, which is a testament to her resilient spirit and determination not to let physical limitations diminish her enjoyment of life. My assessment as a rehabilitation medicine doctor aligns with lifestyle medicine assessment. On physical examination, I notice an antalgic gait. She's walking in a way to avoid pain. She has mild swelling in her left knee, and I can feel that crepitus, that grinding with range of motion. There's tenderness along her medial joint line. Her range of motion is limited. She can only bend her knee to 110 degrees, and she has that small lag in extension. Her quadriceps strength is 4/5 on the left. She can move against gravity and some resistance, but it's not full strength, while her hamstrings are good. She has noticeable difficulty initiating standing, requiring her to use her arms to push off from the chair for support. She also reports increased knee pain during attempts to stand. Her balance shows a mild sway on a single leg stance, and her movement is slow. The blood chemistry tests are all within the normal range except for an elevated total cholesterol and LDL. X-ray confirms moderate tricompartmental knee osteoarthritis. All three compartments of the knee are affected, but it's more severe on the medial side, with joint space narrowing and osteophytes. So her clinical picture matches her imaging. So with Feli's initial presentation in mind, her significant left knee pain impacting her work and her hobby, her overweight status, and her existing hypertension and hypercholesterolemia, we knew that a more holistic approach is what she needed. So our team immediately adopted an integrated and person-centered framework. This meant bringing together the strengths of both rehabilitation medicine and lifestyle medicine, supported by specialists like physical therapists and registered dietitians. We weren't just treating a knee, we were treating Feli, the person, a sari-sari store owner, a family member, and a dancer. Our primary goals for Feli were multifaceted, aiming for comprehensive improvement across her well-being. First and foremost, of course, was pain reduction. We wanted to alleviate that constant ache and reduce the sharp pain she experienced with every step in the market or climb up the stairs. Second, and absolutely critical for Feli's livelihood and happiness, was improving her physical function. This meant helping her walk longer distances, climb stairs with less difficulty, stand comfortably at her stall, and ultimately regain the ability to enjoy dancing to those TikTok videos she loved. Beyond symptom management, we also focused on the long term to slow the progression of her osteoarthritis by addressing those underlying drivers like systemic inflammation and excess mechanical load on her knee. A core tenet of our approach was empowering Feli for self-management. We wanted to equip her with the knowledge and tools to become an active participant in her own health journey, fostering sustainable habits. And finally, we saw this as a powerful opportunity to simultaneously address her existing comorbidities of hypertension and hypercholesterolemia. The very lifestyle interventions we plan for her knee pain, particularly nutrition and physical activity, would synergistically contribute to better blood pressure and cholesterol control, which will truly benefit her entire health profile. So Feli fully understood and acknowledged the importance of the comprehensive lifestyle medicine interventions proposed for her care. She expressed readiness and strong internal motivation to take action, driven by her desire to improve her health so she can better care for her 86-year-old mother and eventually return to enjoying TikTok dancing. So here's how we structured Feli's management with a clear lifestyle medicine strategy at the forefront. So for nutrition, she was immediately referred to a registered dietitian who tailored an anti-inflammatory eating plan centered on familiar Filipino plant-based dishes she already enjoys. We didn't want to drastically change her diet overnight, but we emphasized whole, minimally processed food. Simple, sustained substitutions or exchanges were introduced, such as replacing pork with tofu or mushrooms in traditional recipes like sauteed mung bean sprouts, mung bean soup, swapping infused water with lemon or cucumber for soft drinks and sugary juices. We worked on gradually reducing her intake of fried fast food, salty food, sugary drinks, focusing on portion control and mindful eating. We aimed for a manageable 500 kilocalorie deficit daily, not just for weight loss, but also to reduce systemic inflammation. Physical activity was prescribed in close collaboration with the physical therapy program. We started with low impact options, emphasizing that movement is medicine. As her pain decreased and her strength improved, we gradually increased her activity levels. We intend to get her back to enjoying movement and hopefully eventually back to TikTok dancing. This comprehensive lifestyle medicine approach laid the groundwork. It wasn't just about her knee pain, it was about improving her overall health, addressing her comorbidities of hypertension and hypercholesterolemia, and empowering her to take action. So let's break down the rehabilitation medicine and physical therapy component of Feli's care. Remember, this was tightly integrated with the lifestyle medicine strategies. Our initial focus was on pain management, but with an active approach. We used modalities like TENS to improve temporary relief, allowing her to engage more comfortably in movement. We educated her on using heat packs before activity and cold packs after. We started a trial of topical diclofenac gel for localized pain. Crucially, we emphasized patient education from day one. We explained the reason behind the exercises, the importance of consistent movement, and how to differentiate between good pain and bad pain. We addressed her fears about movement and reinforced the idea that exercise is medicine for her knees. The cornerstone of her rehabilitation was a progressive exercise program carefully tailored to her left knee and her functional needs as a vendor. Her therapeutic exercise program was supervised by a physical therapist. Phase 1 focused on pain reduction and foundational strength. Exercises like quad sets and glute bridges, gentle heel slides for range of motion to improve joint lubrication and reduce stiffness. As her pain subsided, we moved to phase 2, progressing to light resistance exercises like seated knee extensions, wall slides, and step ups onto a low step. We gradually introduced stationary biking, increasing duration and speed, and initiated balance exercises. We also concentrated on gait training to normalize her stride and reduce that painful limp, initially recommending a single point cane specifically held in her right hand, the side opposite the painful left knee for longer distances to reduce load. A home exercise program was a vital component, ensuring daily consistency outside of formal therapy sessions. We encourage low-impact aerobic exercise like walking, initially short distances, gradually increasing. Cycling or swimming to improve cardiovascular fitness without putting excessive stress on her knee. We wanted to get her moving again, even if it wasn't dancing yet. We thoroughly explained the nature of knee osteoarthritis and emphasized the critical role of staying active, directly addressing and dispelling the myth that activity wears out the knee. A significant part of our discussion also involved activity modification tailored to her work. We taught her proper lifting techniques to reduce knee strain, considered ergonomic adjustments for her vendor stall to lessen prolonged standing, and stressed the importance of pacing and rest breaks to prevent overexertion. So it was truly an integrated effort. Now let's fast forward to her 3-month follow-up. So this is where we start seeing the incredible power of consistent lifestyle changes. Her weight is down 7 pounds, a remarkable 5% reduction from her initial weight, already within that 5 to 10% range for significant relief. Her diet has transformed, embracing a healthy home-cooked Filipino plant-based approach. Her typical 3-day recall now includes breakfast of tofu scramble and sauteed kangkong or oatmeal topped with banana. Lunches and dinners are now vibrant with plant-based dishes like mungo guisado with plenty of leafy greens or vegetable curry with brown rice. For snacks, she enjoys fresh local fruits such as papayas, mangoes, and bananas without the added sugar. Sugary juices, soft drinks, and three-in-one coffee have now been replaced by just plain water or green tea. She's now incorporating more legumes, nuts, and seeds into her meals, along with a wider variety of local vegetables and whole grains. Her knee pain has improved significantly, dropping from 7 to 8 over 10 down to a manageable 3 over 10. Her morning stiffness is also notably less. Her function is easier, sitting to standing effortlessly, navigating stairs with less difficulty, and getting in and out of vehicles more smoothly. At her 6-month follow-up, Feli continues to impress. She's lost another 5 pounds, bringing her total weight loss to 12 pounds. So that's nearly an 8% reduction. This is exactly what the research suggests lead to significant symptom improvement. Latest blood chemistry panel returned within normal ranges. Her physical activity has further progressed. She's now walking 30 to 40 minutes, 3 to 4 times per week. And to her delight, she's able to do light dancing again. She's also joined a local low-impact Zumba class for seniors on weekends, which provides both physical activity and social connection. So she also no longer relies on her cane for daily activities. Her knee pain is consistently 2 over 10 with only occasional mild flare-ups after prolonged activity, which she manages effectively with heat and rest, showcasing her improved self-management skills. Her function has significantly improved, and she reports a profound increase in independence and confidence. Her overall well-being is dramatically better, and she's truly enjoying her life more fully, participating in ways she thought were lost to her. So this is the power of lifestyle medicine and rehabilitation combined. What can we learn from Feli's inspiring story? So it highlights the absolute necessity for a holistic approach, integrating lifestyle medicine principles, addressing diet, activity, seamlessly combined with targeted rehabilitation for functional restoration. More important than anything was the patient's engagement. She was an active participant, not a passive recipient. Her adherence to the plan was crucial for these outcomes. It showcases the power of interdisciplinary collaboration, the smooth integration between lifestyle medicine, rehabilitation medicine, nutrition, and physical therapy services. The strategy of gradual progression was key. Starting small and slowly building momentum prevented overload and ensured she stayed consistent. And finally, the focus was always on sustainable changes, building long-term habits and not seeking quick fixes. This is what truly transforms lives, allowing for lasting relief and improved quality of life. So this slide truly encapsulates the collaborative care model that I believe is ideal for managing complex conditions like knee osteoarthritis. It starts with initial assessment as a lifestyle medicine physician, identifying knee osteoarthritis and its comorbidities. Then critically, there's a shared goal setting. The patient, the lifestyle medicine physician, the rehabilitation specialist, the nutritionist, and the physical therapist all collaborating on realistic functional goals that matter to the patient. We then implement concurrent interventions, the nutrition counseling, the precise exercise prescription, all happening in parallel, reinforcing each other. There needs to be regular communication between all providers to track progress and adjust plans. And finally, long-term follow-up is essential to reinforce those healthy habits and prevent recurrence. This integrated approach is truly powerful. As we conclude our discussion, let's reflect on the profound simplicity and enduring power of Hippocrates' words. If we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. He also made it clear eating alone will not keep a man well. He must also exercise. So these aren't just ancient words, they are a timeless blueprint for well being. And when combined with the modern understanding of sleep, connection, and stress management, we have the true cornerstones of a healthy life. Thank you so much for your attention and your dedication to your patients. I hope this has been insightful and practical.